Hi everyone, this is Dr. Stefan. In this video, I'd like to talk about a comment that I received on the channel relating to palpitations and potential connections to inhalers or other things. And I will emphasize other things in this video. Let me show you the comment. So I do get a lot of these sometimes. Now, obviously, you have to understand that I'm not your doctor. I'm not seeing you clinically. I don't know exactly what the story is in your case. But some of these comments sometimes worry me slightly. So, for example, such as this one. So I did try to talk about palpitations, which you may get sometimes from asthma inhalers. It's possible. It's possible sometimes if you're taking a lot of Ventolin inhalers. So, for example, this one, if you're using a lot of it, you might feel like your heart's skipping a beat or something like that. So you may perceive your heartbeats. It's possible because they are quite stimulant medications. So sometimes they can have that as a side effect. Normally, they're quite safe though. However, when I see this comment, I also worry that there may be other things at play. So this is where I want to just stress that if you are having issues with your heart, any palpitations, any symptoms that are really worrying, I think your best bet is to actually check with your doctor who can actually provide a consultation. In your case, there may be so many reasons for that. So look at the comments. So Zaidul Rehman Sheikh, from India. So he's saying that he's 34 and having these palpitations for the last 3 months. Along with it, itching and choking in the throat. So I'm not sure. So obviously, when someone describes these sensations, these symptoms that they're having, it's really, really hard for anyone on the internet to give you the right answer. So the best thing you can do is really check with your doctor. So Saidul, I'll sort of give you a little reply to tell you that I've recorded this video, and hopefully you go and see someone about these symptoms. They may be related to your inhaler, but they may not be. So obviously, if you've started an inhaler 3 months ago and every time you take it, you feel some palpitations, potentially there may be a connection. However, if you've been having these palpitations in your heart for the last 3 months and they don't seem to be connected to your inhaler, especially if they occur at rest. So you're not really exerting yourself. You're not in an anxious mood. You're not doing anything strenuous that might trigger your heart rate to go up. I think it's a good idea to talk to your doctor. And usually simple tests will be done in the first place, such as, first of all, there will be a bit of a consultation. Your doctor may listen to your heart. They may feel your pulse to see whether your heart rhythm seems regular. The next thing might be to do an ECG if there's any, so basically just a heart trace. So this is where we just check. We put some electrodes on the chest. We measure how the heart rate rhythm, the electrical activity of the heart looks like. And the next thing to do is sometimes to have that ECG recorded over a period of 24 hours. So that will give us an indication of what the palpitations look like when we measure the electrical activity of the heart. Is there an abnormal rhythm there? So all these things are important. It's important to look into palpitations. Sometimes even young people may experience palpitations. Some of them are completely non-pathological. They may happen to a lot of people, but if they happen a lot, if you've noticed them happening for a few months and they don't seem to be going away, especially if they're happening at rest, I think it's a good idea to check with your doctor. I would say that's the safest thing to do. And if nothing is found, all the best. It's all the better. So you just go from there. Hopefully this was helpful. And if you've got any other questions, do leave them in the comment section below. All the best, good health.